Welcome you all once again to our YouTube channel. Today we are starting with the Neet PG one-liners on the topic of cranial nerve. Every now and then, every year mostly, they're asking you questions on the cranial nerve, and the examiner will give you the options, which is the classical findings if a nerve is injured. Say for example, if a cranial number 1 olfactory is injured, they'll give you the history of anosmia. Why? Because it is the most common feature, most common finding. Or they'll give you the fracture of the cribriform plate in a trauma case. So you have to identify that this cranial nerve is injured. Now moving to the cranial number 2, they'll either give in the option a Marcus gun pupil, or they will alternatively write that it is a relative afferent pupillary defect, and both these things indicate the lesion at the anterior to the optic chiasma. Now cranial number 3, that is oculomotor nerve, you have to find three things in the question. First is the position of the eye, that is the down and out position of the eye along with the ptosis, and third is the dilated non-reactive pupil. If we find these three things, it is clear-cut injury to the cranial number 3. Now cranial nerve 4, patient presents with the vertical diplopia and the head tilts away from the side of the lesion to compensate. Classical clinical history to find out the cranial nerve injury number 4. Now cranial nerve injury number 5. For the fifth nerve, V1 counterpart, there is a loss of the corneal reflex because it is an afferent limb, and it is a primary diagnostic indicator of the V1 lesion. For the V3, for the V3 cranial nerve 5 V3 part, there will be deviation on the jaw, occurs towards the side of the lesion upon opening the mouth. Classical clinical finding that they will mention in the examination.